While most Americans expect a vaccine to be available at some point in 2021, a new survey by the Associated Press also finds that many people in the country are skeptical about actually using it. For more on this, let's bring in internal medicine specialist Dr. Neeta Ogden. Dr. Ogden, these aren't just anti-vaxxers that are skeptical of a rushed vaccine. If the government fails to convince the public of its safety, what kind of consequences are we looking at?
Yeah, I really liked this study because I think it highlights a very important point. We're in a race to develop a vaccine globally, but what's also really important nationally is a huge public health effort, which has always lagged in this country. And we need to manage people's expectations about the vaccines and reset their ideas about the safety of the vaccine and what implications it could have for people. In this study that you mentioned, about 20% of people say that they won't get the vaccine. Why? 70% of these people are worried about side effects. About 40% of these people are worried that they could actually get the coronavirus from the vaccine. This is going to require public health education so that we really can get a lot of people on board to being vaccinated.
You know, the thing about it is we've all been told over and over again that, that this is a rush to get to this vaccine. Typically, vaccines take much, much longer. And there's an awareness or there's a concern that the proper procedures won't be followed. It's funny, I thought, Doctor, because instead of sort of feeling a lot of pride and confidence in our medical research facilities and their ability to do this in sort of a crunch situation, people are skeptical. And I think that part of the problem is there's been so much misinformation, so much conflicting information in general about healthcare in relation to COVID-19 that people really don't know who to trust and who to believe. So not only are officials going to have to convince people that it's imperative to get this vaccine if we want to contain this pandemic, but then they have to combat all this other misinformation that's out there. Can we talk about that?
Yeah, and I think you're absolutely right. There's so much information. It's coming out every single day, just a real deluge of a lot of information. If you're not even a doctor or in the public health environment, it's almost too much to process. So I think the big thing here is going to be, once we do have a vaccine, is to create a message that really conveys what we can expect this vaccine to do, and very realistically share this with the community at large. I think that one of the big problems here is that people expect vaccines to provide something that we call sterilizing immunity, complete prevention of infection. And let's reset expectations. We may not be there yet. That might be a second generation vaccine. Right now, as we do rush to create a vaccine, we may end up with something more like the flu vaccine that mitigates the infection, not necessarily prevention, but prevention of severe disease. Could we be going from COVID-19 pneumonia to a more upper respiratory like common cold? That would be a huge, significant step as well. So it's kind of about managing expectations and creating a clear message once we do get to that point where we're able to provide vaccine to the country.
It's so interesting. And Doctor, this is probably going to be the first time in history, at least in modern American history, that medical professionals, doctors, scientists like yourself are facing something like this, where the politics around this pandemic are in some ways damaging the prospects for healing the country. In other words, there will be some people who will not trust the vaccine because of the reasons we've been listing here. And that means that a lot of people will get sick and potentially die. And I'm just struggling to, I started doing a little research just to see if something like this had existed in modern medical history, because you got to go back really, really far to find a point in time in history where people are not trusting of the science or the recommendations of doctors. And so I wonder, for somebody like yourself, I mean, it seems as if there's very little that you can do. You're not going to be the one who's going to be able to be, I mean, you can do interviews with us on television and with other news organizations, but realistically, I mean, if this is not something that is a unified message, not just from the medical community, but from the people who lead us, our politicians, then you're going to have an uphill battle.
Yeah, you're absolutely right. And aren't we seeing that right now when the basic practices of social distancing and wearing a mask aren't coming out as a clear message from our, our government and our leaders. So it's misleading people at large about how to avoid coronavirus. And we're seeing that play out. For example, this last weekend, again, the same thing happens when the vaccine shows up. If people don't have a loud and clear message about how it can be effective and how it can lead to a more safe reopening of schools and businesses, it's simply not going to work. I mean, ultimately, what can you do? Force people to get a vaccine? I mean, we have had to do that actually more recently in, for example, New York City, that tri-state area with the measles outbreak. So, we may end up in a situation like that where, again, we're going to have to ramp up the public health education so people have a better understanding of how the virus and the vaccine work and how they can effectively allow us to go back to a normal life. Again, it really depends on what vaccine ends up being sort of approved and used in the fall. And what kind of side effects do we see from this vaccine? We do need more information before we can probably properly educate the public.
So, Doctor, before we let you go, part of the reason we have you here is to sort of clarify things that might be a little confusing to people. I want to talk about the CDC, that they had sort of tweaked their wording about the virus on surfaces, and then there was a big reaction to it, and then they kind of clarified what they meant. Can we just go over it again? Viruses on surfaces, is that a risk?
Okay, I mean, I feel like nothing's that different from what we talked about even last week, which is that it's not the significant form of spread. The primary way that COVID-19 is spread is through respiratory droplets when you're near somebody, talking to somebody within 6 feet of them. But we still are learning how this virus is spread. And so it's not completely out of the question that it would be on a surface. And if you touch that surface and you touch your face and your nose, your mouth, that you could potentially get infected. So all this points to is that, yes, it's a possibility. No, it's not the primary way, but finally, we need to continue these basic practices of hand washing, sanitizing, disinfecting, and social distancing with masks.
Doc, I know Anne-Marie said that this was the last question, but I do have one more for you, because I was looking back at vaccines that were commonplace in my lifetime for children, especially in the late 1960s, early 1970s. And I'm looking at a list here: smallpox, diphtheria, tetanus, whooping cough, polio, measles, mumps, rubella. All things that I never had, but I know people who are older in my family who did have. I remember as a kid stepping on a nail and my grandmother freaking out that I was going to get tetanus and lose a leg, and my mom had to say, no, that doesn't happen anymore because he's received the vaccine for that. And the idea now that you have people that are resistant to some of these vaccines, and we've started to see in the case of some of these disease outbreaks popping up again. Are you worried about that?
Yeah, no, certainly. And I think that last story you did really points to people not going to emergency rooms. But there's a lot of data that people aren't doing their regular health maintenance and kids are not getting their vaccines. So I'm hoping that, again, with this large public health education, that we need to start going back to see our doctors. Kids absolutely need to follow their vaccine schedules because, yes, we did see this with measles, that when you don't get vaccinated, outbreaks occur, people can get very sick. And just reading about vaccines like you did, the history of vaccines, the polio, when it was prevalent was terrifying. I mean, people were paralyzed, kids were being kept home, very similar to right now with coronavirus. So there's a real aspect that if you don't get vaccinated and we have an outbreak, that it can lead to such significant damage already in this climate where our healthcare systems are stressed by, figuring out this virus, how it presents in children, and racing to get that vaccine.
Dr. Ogden, thank you so much.
Thank you for having me.